millions of Americans with diabetes experience silent threats each year, including sudden rises in blood sugar levels above 180 mg DL, nerve burning, overworked kidneys, and heart danger. What if the food on your plate had the ability to defend itself? What if a single adjustment might help reduce post-meal increases by 25 to 30 milligrams per deciliter, lower fasting glucose by 10 to 15 milligrams per deciliter, and even help lower HbA1c by 0.3 to 0.5% over several months? The top 10 foods for diabetics to reduce blood sugar are shown in this video. Decisions supported by actual studies that safeguard your blood vessels, kidneys, heart, and nerves. Pay close attention. Make notes and learn how your body and health can be subtly changed with every bite. Steel-cut oats is the first. Despite their seemingly straightforward appearance, steel-cut oats serve as a silent protection for a diabetic's body. Steel-cut oats release glucose gradually, reducing post-meal rises by up to 30%. This is in contrast to instant oats, which raise blood sugar levels quickly. Regular oat consumption can increase insulin sensitivity by 15% in a matter of weeks, according to studies conducted in the USA. And when they take the place of refined carbohydrates, even HbA1c might decrease by over 0.5%. There is more to this than sugar statistics. It's about safeguarding your kidneys, heart, and nerves. Steel-cut oats beta-glucan fiber slows digestion and lowers cholesterol by 7 to 10% by forming a gel in the stomach. Additionally, reducing the strain on arteries reduces the chance of vascular disease. This translates into improved blood pressure, stronger circulation, and less harmful glucose fluctuations. All essential for senior citizens. Additionally, the same soluble fiber promotes intestinal health by nourishing beneficial microorganisms, which tangentially boosts immunity and reduces inflammation. According to long-term research, constant glucose lowers the risk of diabetic kidney disease progression by about 20% by preventing the kidney's small filters from being overloaded. Balanced blood sugar reduces nocturnal cramps and scorching discomfort in the nerves. Because oats help maintain a continuous flow of glucocedoneurons that assist memory and focus, even the brain benefits. Cooking is important since the glycemic index stays around 52 when oats are simmered slowly in water or unsweetened almond milk for 20 minutes over low heat. Instant oats that rise above 75 are far less dangerous. Around half a cup of cooked dry oats, or around 27 grams of carbohydrates and 4 grams of fiber, is the ideal daily intake. But overeating can backfire. When 2 or more cups are consumed in one sitting, the carb limit may be exceeded, causing a significant rise in blood sugar levels and possibly discomfort or bloating. Portion control is crucial for diabetes. Additionally, the glucose curve is softer when oats are combined with protein sources like Greek yogurt or almonds. Many people make the mistake of adding sugar, honey, or flavored milk, which negates the benefit. Steel-cut oats are one of the safest breakfast options, especially when served simply with fruit or cinnamon. Here's the intriguing bit, though. Their impact extends beyond the day-to-day. Compared to non-eaters, long-term oat eaters have an approximately 25% decreased risk of cardiovascular events. Chia seeds are number 2. Despite their small size, chia seeds have a power that Americans with diabetes cannot afford to overlook. Several studies have shown that consuming only 25 grams every day can reduce post-meal glucose rises by as much as 39%. Because of their unique combination of soluble fiber, plant-based protein, and omega-3 alpha-linolenic acid, the thick gel they form in the stomach slows down the absorption of sugar, allowing our insulin receptors more time to react. In some clinical trials, this improved insulin sensitivity by almost 20%, and when taken regularly, it also helps lower HbA1c levels by about 0.5%. It's not just about the numbers here. It's about preserving your heart by reducing LDL cholesterol and triglycerides, helping your kidneys by relieving pressure on filtration, and even reducing diabetic neuropathy-related nerve sensitivity by reducing inflammation. Stable glucose control lessens stress on the liver, skin, and eyes, maintaining the balance of all organs, while the magnesium therein helps relax blood vessels, enhancing vascular health. Because these seeds provide both slow-release carbohydrates and vital minerals, many seniors report less cramping at night and more consistent energy. Here's the intriguing bit, though. Over 40 grams of chia per day can have negative side effects, such as bloating, diarrhea, or even a reduction in blood pressure when taken with antihypertensive medications. Additionally, the high omega-3 concentration may increase the risk of bleeding for people using blood thinners like warfarin. Because chia functions as a soft shield at the proper dosage, reducing abrupt crashes, reducing fasting glucose swings, and silently safeguarding several systems at once, moderation is crucial. The true question is, are you allowing these potent seeds to do their magic for you? Or are you neglecting one of the most straightforward everyday foods that could stabilize your blood sugar and protect your body? Flax seeds come in third. Have you ever wondered why flax seeds are referred to as a diabetic's hidden weapon? You can't let these tiny brown seeds stay in your kitchen jar and do nothing. They contain potent chemicals that U.S. scientists believe improve blood sugar regulation and delay the progression of diabetes. Their secret is lignans, which are unique plant molecules that affect how our systems use insulin. Studies have shown that a consistent consumption of these compounds can reduce HbA1c by 0.5 to 1% and increase insulin sensitivity by up to 20%. In contrast to other foods, flax's soluble fiber, about 3 g per tablespoon, forms a mild gel in the stomach that retains glucose and postpones its entry into the bloodstream, reducing post-meal increases by up to 28% and avoiding the abrupt weariness that diabetics frequently experience after eating. Alpha-linolenic acid, a plant omega-3 that contains over 1.6 grams per tablespoon and subtly protects neurons, reduces kidney inflammation, and promotes heart health by maintaining artery flexibility, makes them even more curiously effective. For noticeable results, add just 1 to 2 tablespoons of ground flaxseed per day to yogurt, smoothies, or porridge. However, going beyond 5 tablespoons could result in bloating, diarrhea, or decreased absorption of nutrients. Additionally, anyone taking blood thinners should exercise special caution. In addition to controlling blood sugar, flax contains 60 milligrams of potassium and 40 milligrams of magnesium per tablespoon, which both help to maintain heart rhythm and ease muscular cramps. Its antioxidants slow down the hidden harm that diabetes can do over years, reducing oxidative stress by up to 25% across the liver, pancreas, and blood vessels. This is the intriguing part. By preserving sensitive ocular vessels, these tiny seeds can also assist men and women maintain a healthier metabolism and prevent retinopathy. They also have an impact on hormonal balance through lignans. Lentils come in at number 4. Despite their unassuming appearance, lentils have a subtle yet surprising effect on a diabetic's body. About 18 grams of protein are found in 1 cup of cooked food. Additionally, this protein promotes muscle tissue that burns sugar more effectively, stabilizes glucose entry, and slows stomach emptying. 15 grams of fiber are included in the same serving. Additionally, dietary fiber improves insulin sensitivity, lowers post-meal increases by almost 30 mL per deciliter, and gradually lowers HbA1c by nearly 0.5%. About 6.5 milligallons of iron is included, which helps to produce red blood cells and avoids the exhaustion and dyspnea that many elderly people experience when high blood sugar impairs the supply of oxygen. The 70 milligrams of magnesium therein enhances insulin receptors' capacity to transport glucose into cells, safeguarding cardiac rhythm and nerves. Additionally, a meal contains 730 milligrams of potassium, which reduces silent vascular damage by lowering heart strain and easing blood vessel tension. At 358 micrograms, folate decreases homocysteine and fixes damaged DNA, shielding the kidneys and brain's tiny blood vessels from the damaging effects of sugar. The 3 milligrams of zinc boosts immunity against infections that increase while blood glucose levels are elevated and aids in the healing of wounds that diabetics frequently experience. At 356 milligrams, phosphorus maintains the stability of the skeletal system and energy balance by supporting bones and cell membranes. Lentils maintain a low glycemic index and a potent preventive effect when cooked by gently boiling them for 20 to 25 minutes. However, they might cause unanticipated sugar increases when fried or combined with white rice or potatoes. About 1 cup cooked is a safe daily intake. More than 2 cups can result in bloating, mineral imbalance, and an excess of carbohydrates. The sugar drop may be more severe than anticipated for people taking insulin or metformin. Thus, dosage adjustments may be necessary to prevent hypoglycemia. Quinoa may appear to be a straightforward grain, but it contains a potent secret that all diabetics should be aware of, since it is a tiny seed that is rich in fiber, magnesium, and full protein, all of which have a direct impact on how our systems process sugar. Quinoa's low glycemic index of roughly 53 maintains stable glucose levels, preventing harmful surges after meals and resulting in a smoother fasting blood sugar in the morning. This is in contrast to refined grains, which cause blood sugar levels to fluctuate. After months of regular use, its soluble fiber slows down digestion and increases insulin sensitivity by over 25%, which helps cells respond better to insulin and decreases HbA1c by up to 0.6%. The potassium and magnesium in quinoa help the heart by supporting appropriate blood pressure and gently relaxing blood vessels, preventing stiff arteries and poor vascular health. Its continuous supply of B vitamins helps the nerves, which lessens the tingling and pain that diabetics frequently experience. Its plant-based protein, which is simpler to digest than red meat protein, protects the kidneys, which lessens the load on already vulnerable organs. Quinoa's antioxidants, such as quercetin, help detox pathways by lowering fat accumulation and raising enzyme levels in the liver. Iron and zinc provide power to the immune system, while manganese and phosphorus fortify muscles and bones to prevent weakness. It is best to eat half to 1 cup of cooked food every day, but if portion proportions are not followed, eating too much, especially more than 2 cups, can cause bloating, upset stomach, and even elevated blood sugar. Seniors should rinse their quinoa before cooking it to get rid of saponins, which might otherwise cause stomach irritation. When consumed in moderation, Quinoa transforms from a grain alternative into a mild weapon against blood vessel weakness, unstable sugar, and silent neurological damage. Greek yogurt comes in sixth. Greek yogurt may appear to be just another dairy product, but it contains a secret ingredient that alters how a diabetic's body processes sugar. It slows down digestion and prevents glucose from racing into the system since it contains almost 10 grams of protein per 100 grams. As a result, insulin sensitivity steadily increased and there were fewer post-meal increases. 110 milligrams of calcium per 100 gram is concealed within. Although most people think of it as bone strength, diabetes affects it in several ways. It reduces the likelihood of nerve discomfort and even protects the heart from arrhythmias brought on by elevated blood sugar levels. Next are probiotics, particularly strains of lactobacillus. The gut-brain axis reacts when they reduce inflammation in the gut. Insulin resistance decreases. When fasting glucose levels drop by 10 to 15 millibars DL, the body subtly regains control. Another secret weapon is its 150 milligrams of potassium per 100 grams. By balancing sodium, it lessens the strain on the kidneys, which are already under stress from diabetes. In addition, it shields the vascular system by reducing blood pressure, which causes silent vessel injury. Additionally, there is vitamin B12, 0.5 micrograms per 100 J. Without it, memory blurs, feet tingle, and nerves go numb. It keeps the brain clear, red blood cells functional, and nerve signals alive. It matters that there be 11 milligrams of magnesium per 100 grams. It breaks down insulin resistance and relieves muscle cramps caused by poor circulation by promoting more than 300 enzymatic processes. Because of its zinc content, wounds heal more quickly, avoiding the gradual, recalcitrant skin damage that diabetics fear. Over months, 1 cup per day can reduce HbA1c by 0.3 to 0.5%. However, this is where the trap is. Excessive amounts can backfire. Excess fat and protein might strain the kidneys. Weight gain may result from hidden calories. Insulin resistance also resurfaces. People who are lactose intolerant may experience pain, bloating, or worse. The only safe route is to eat plain, unsweetened quantities. Greek yogurt is not what it seems, even though each spoonful appears innocuous. It silently protects the brain, heart, kidneys, nerves, and arteries from the silent conflagration of diabetes. Eggs, number 7. Not many diabetics really recognize the mystery that eggs carry. However, their high protein content has the ability to slow down digestion and maintain stable blood sugar levels for a long time after eating. Eggs include high-quality protein that does more than just help you gain muscle. It reduces the chance of harmful post-meal spikes, which can increase by 40 to 60 milligrams per deciliter following a breakfast high in carbohydrates by regulating the flow of glucose into the bloodstream. The yolk's good fats increase insulin sensitivity, which enables cells to react more effectively to the insulin that is already present and reduces fasting glucose by modest but steady amounts. Choline, a substance essential for memory and nerve function, is found inside that golden yolk. It shields the brain from diabetic nerve damage, which is subtly deteriorated by elevated blood sugar levels. Additionally, eggs contain antioxidants called lutein and zeaxanthin, which protect the eyes from diabetic retinopathy, one of the most dreaded side effects. While the B12 in eggs shields the nerves from the tingling and numbness that many diabetics experience in their hands and feet, The selenium level boosts the immune system and speeds up healing. Moderate egg consumption can reduce HbA1c by 0.3 to 0.5% over weeks, according to studies conducted on individuals in the U.S., resulting in a noticeable change in long-term glucose control. Even the phosphorus and riboflavin found in eggs contribute subtly to energy metabolism and kidney function, two organs that are frequently silently attacked by diabetes. Here's the catch, though. In sensitive people, eating more than 1 or 2 eggs a day may increase LDL cholesterol, putting additional strain on the heart and blood vessels that are already susceptible to sugar-related damage. Balance is crucial since overeating can result in weight gain and an increased risk of arterial plaque. 1 egg a day, or up to 7 a week, is safe and beneficial for the majority of U.S. diabetics. But exceeding this can tip the scales in favor of hidden difficulties. Almonds, number 8. Although almonds appear to be just another nut, most diabetics are unaware of its hidden benefit. A little handful of almonds, roughly 28 or 23, provides more than simply crunch. It conceals 14 grams of slow-dough digesting fats, 3.5 grams of fiber, and 6 grams of protein, which subtly prevent glucose floods and reduce post-meal spikes by almost 30 milligrams per deciliter. Their 80 milligrams of magnesium in only 1 ounce is even more impressive because it releases insulin receptors, reducing insulin resistance by 10 to 15%. A change significant enough to lower fasting blood sugar and reduce HbA1c by 0.3 to 0.5% over several months. There is a shield inside every nut. In addition to shielding the kidneys from the oxidative stress that causes the quiet damage of nephropathy, vitamin E and polyphenols envelop delicate neurons, shielding them from the searing pain of neuropathy. The 200 milligrams of potassium per ounce reduces the risk of arterial stiffness and abrupt cardiac rhythm collapse by stabilizing blood pressure and fortifying delicate vascular walls. The lipids themselves alter blood chemistry by increasing HDL, decreasing LDL, and preventing the accumulation of plaque, a sign, which is sometimes overlooked until it is too late. Additionally, the fatty acids improve brain clarity and clear the dense mental fog caused by high sugar, while zinc and manganese hasten the healing of wounds. Here's the twist, though. Excessive amounts prove detrimental. If you consume more than 2 ounces of almonds each day, the same almonds give your body too many calories and lipids, which can lead to weight gain and exacerbate insulin resistance. Additionally, too many can increase the danger of kidney stones by overloading the gut with oxalates, particularly in susceptible patients. There are hidden threats. Constipation from not drinking enough water, bloating, and in people who are allergic to nuts. A single error can lead to catastrophe. Making the incorrect choice, roasted or salted almonds, allows harmful oxidized lipids and hidden salts to enter, turning protection into harm. 9. Walnuts. All walnuts appear to be are brain-shaped shells. However, they possess an odd force that disturbs diabetes in unforeseen ways. With a glycemic index of just 15, they virtually never raise blood sugar levels, preventing both fasting glucose and post-meal increases. 1 ounce, or roughly 14.5, contains more than 45 mTOF magnesium, 2.5 g of alpha-linolenic acid, and 2 g of fiber, all working together to increase insulin sensitivity, allowing sugar to enter cells rather than float in the blood. According to U.S. clinical trials, Consuming 30 grams of walnuts per day can improve overall insulin resistance and lower HbA1c by 0.2 to 0.3% in just 3 months. Their omega-3 fats protect arteries, lower LDL cholesterol, and even lessen plaque buildup, which frequently results in a heart attack for diabetics. They also reduce inflammation, which slowly erodes the heart. By protecting delicate neurons from oxidative stress, the high antioxidant load, defined as more than 20 milligrams of antioxidants per 100 grams, delays the excruciating progression of neuropathy. Walnuts serve as silent protectors for the kidneys, decreasing albumin leakage and the stress brought on by too much sugar. Their arginine concentration promotes the synthesis of nitric oxide, which maintains arterial flow and stops the quiet hardening of vessels that causes stroke and amputations. Studies reveal that eating walnuts improves memory and focus, proving that the brain benefits as well. Something important for diabetics who frequently suffer from fog. Here's the dubious twist, though. Consuming more than 2 to 3 ounces daily can make the same ally hazardous, since the calories quickly accumulate and cause weight gain, and if consumed carelessly, the oxalates within can increase the risk of renal stones. Additionally, too much omega-3 thins the blood, increasing the risk of bleeding. Walnuts feel like a riddle because of this. 3 handfuls could betray, yet 1 heals and 2 protect. Would you put your trust in them? Rice and PAB. White rice could never reveal the secret that brown rice does. Its glycemic index of 50 to 55 prevents blood sugar spikes by slowing digestion. Brown rice maintains a line, in contrast to white rice, which can raise post-meal glucose by 60 to 80 milligrams per deciliter. 1 cup contains 86 milligrams of magnesium, a silent weapon. In long-term research, this mineral reduces fasting glucose by over 15 milligrams per deciliter and increases insulin sensitivity, which pulls sugar into muscles. It governs, not rushes. The fiber follows next. Only 3.5 gram per cooked cup is sufficient to reduce spikes, slow down carbohydrates, and lower HbA1c by 0.3 to 0.5%. Whether sugar eats away at organs or stays controlled depends on that tiny drop. Defenders are concealed by the bran layer. Strong antioxidant ferric acid reduces the incidence of neuropathy by protecting delicate nerves from oxidative damage. B vitamins that support nerve messages and maintain stable brain energy include niacin and thiamine. The heart is also affected. Potassium with lignans reduce blood pressure and LDL cholesterol by over 7%. Arteries relax. Blood flows more freely. Instead of breaking, vessels bend. There is also comfort for the kidneys. Sugar overflow that damages small filters is avoided with a lower glycemic load. Manganese and phosphorus help maintain balanced enzymes and strong bones while preventing diabetic neuropathy. The liver even recovers. Brown rice reduces systemic inflammation, a secret cause of insulin resistance, and aids in detoxification. However, the shield is cracked. Just half to 1 cup per meal is a safe plate size. The same carbohydrates can work against you after that. Brown rice also conceals another threat. Its grain contains arsenic, consumed in excess every day. It increases the risk of cancer and strains kidneys in a silent manner. People with severe kidney illness need to exercise caution. It can be harmful due to its phosphorus. There are more uses for brown rice. It's a slow, controlled shield, but if you push it too hard, it might stealthily retract. Not all 10 of these foods are ingredients. They are your covert partners in the fight against insulin resistance, blood sugar spikes, and the daily silent harm caused by diabetes. Include them in your dishes. Over time, see how your HbA1c improves, post-meal spikes decrease, and your fasting glucose stabilizes. Your vessels, nerves, kidneys, and heart will all silently appreciate it. Please hit the like, subscribe, and notify buttons if you thought this video was useful so you don't miss any future health-related advice. Give this to a person in need. Make minor adjustments now to manage your blood sugar before it becomes out of hand.